Well, over the past year, I've gotten a number of questions from viewers asking my opinion about using Retin-A or Tretinoin as an anti-aging beauty treatment for wrinkles and hyperpigmentation. Questions like, I'm afraid of using it because of the side effects. What are your thoughts? Can I use it around my eyes? Well, I did some research for you and put it all together in this video to share with you. The information in this video is offered to help you in your decision on whether to use Retin-A or Tretinoin as an anti-aging treatment for wrinkles and photoaging of the skin. It is based on my own personal research from available public sources. I am not a medical practitioner, and it is not meant to be medical advice. I hope you will watch this entire video because I care about you and I want to help you be happy and healthy. Hi everybody, it's Linda. Welcome back to Tips for You. Well, today I want to talk to you about Retin-A for use as an anti-aging beauty treatment of the skin. More and more women are turning to using Retin-A to help reverse wrinkles and prevent wrinkles and to help with sun damage that was caused by too much time spent in the sun to leave spots on their skin. And what was once recommended for women who are in their 50s, say, who have signs of aging, is now being targeted to younger women, in their 20s and 30s. And they're being told that, the younger you start, the better it is, the more results you'll achieve, and the better your skin will look as you age. But does it really work? Retin-A, or Tretinoin, as it's called, has been called the gold standard of anti-aging. But is it really? Well, if you're interested in using Retin-A as an anti-aging beauty treatment for your skin, then you should be aware that you'll be crossing over from the world of cosmetics into the world of pharmaceutical drugs. And that's why I did this video. I want to help provide you with some information about the risks and side effects that are associated with using Retin-A that I think you should be aware of. In this video, I will address the following topics. What is Retin-A or Tretinoin? FDA regulations you should be familiar with. How does it work when applied? Does it really prevent or reverse wrinkles and aging of the skin? Is it safe and effective for long-term use? Will it tighten or lift sagging skin? Why it may be bad for you, and I'll discuss the side effects and the systemic risks. Can you use it around your eyes for crow's feet or droopy eyelid skin? And are the risks worth the reward? Please use this video as a stepping stone for you to do your own research, because there is a lot out there available and you should be well informed before you decide to use it. So what is Retin-A? Well, if you're not familiar with Retin-A, I will tell you briefly. Retin-A is the brand name for Tretinoin, and Tretinoin comes in many different brands. You may have heard of some of them. There's Refisa, there's Atrilin, there's Avita, there's Renova, there's Retin-A Micro, that's to name a few. It should be noted that no matter which brand you are prescribed, they are going to have the same effect on your body. They all contain tretinoin. Tretinoin belongs to a class of medications called retinoids. And retinoids are medications that are derived from vitamin A. They come in an oral and a topical form. The FDA has 5 pregnancy categories for its medications. They range from Category A, which has well-controlled studies that have failed to demonstrate any risk to a fetus, to Category X, where studies have shown positive risk for fetal abnormalities in humans. It's important to know the risk to a pregnancy or developing fetus whenever you take any kind of medication. Now, Tretinoin is a Category C drug, and that means that it is not recommended for anyone who is pregnant or wishes to become pregnant because of the risk of birth defects. This is because topical Tretinoin has been shown in clinical studies to cause birth defects in laboratory animals. This information has been known for over 2 decades. There are no adequate and well-controlled studies in pregnant women. Also, it is not known whether this drug is excreted in breast milk, so caution should be exercised if you are breastfeeding. The oral form of tretinoin, called isotretinoin, is a Category X drug as rated by the FDA and has been shown to cause birth defects in humans. You may recognize it by its familiar brand name, Accutane. I will be talking more about the oral form of tretinoin later in this video because I think it's relevant if you're going to be using the topical form. And that's why tretinoin is regulated by the FDA. You need a prescription for it, and you have to be under a doctor's care if you're going to be using it. Now, there are two versions of Retin-A available in the topical form. One is for acne only, and that is Retin-A in the strengths of 0.01% to 0.1%, and that's available in a cream or in a gel. There's also Renova, which is tretinoin as well, and that's available in a cream in strengths from 0.02% to 0.05%. And Renova is the tretinoin that is approved by the FDA for use in the topical application to mitigate fine lines. Clinical studies have shown that the higher strengths of tretinoin will not offer any additional improvement of fine facial wrinkles over the milder strengths, but they may be more irritating, and that the main difference between the gel and the cream is the formulation of the base it's delivered in. Renova, for example, has some extra moisturizers in it. So basically, to clarify that point, if you use the strongest Retin-A, the 0.1%, which is the tretinoin that is approved for the treatment of acne, you will not achieve any additional improvement in your wrinkles versus using the lower strength Renova, which is the tretinoin that is approved by the FDA for the mitigation of fine wrinkles. What you may cause using the higher strengths is more irritation to your skin. A little interesting history for you on tretinoin. It was first developed as an acne treatment for the skin by dermatologist Dr. Albert Kligman in the 1960s. Soon after Retin-A was approved, Dr. Kligman began to notice that patients treated with Retin-A had smoother skin. So he went back to the drawing board and he developed tretinoin cream Renova for the treatment of anti-aging, which hit the market in 1996. An interesting fact is that Dr. Kligman died in 2010 at age 93 and was never a user of his anti-wrinkle invention. So let's take a look at how Retin-A, or tretinoin, works in the skin. So how does tretinoin work? Well, it works by sloughing off the outer layer of your epidermis, called the stratum corneum. That's your dead skin cell layer. And then it penetrates in to activate the formation of collagen in your skin. So new skin cells form and they migrate their way back up to the surface of your skin, and you are supposed to have newer, fresher, younger looking skin. You know, it's supposed to have a pinkish glow and be smoother. And this process is rapidly increased with the Retin-A over just your normal differentiation process that goes on for the sloughing off of dead skin cells and the renewal of your skin. So the Retin-A will speed that up. What it also does is it suppresses your melanin formation, and then by suppressing the production of melanin, you don't get the dark spots coming back. So it does both, and it also decreases oil production of the skin. So you have a lot going on here when you use tretinoin. And like I said, it's a pharmaceutical drug. The definition of a pharmaceutical drug is something that alters the structure or function of your skin, whereas a cosmetic does not. You apply it and it does not alter the structure or function, but tretinoin does. Well, you might be thinking that so far it all sounds pretty good, right? There's a medication that claims to rejuvenate aging skin, and it's made from vitamin A, which is a vitamin the body needs to be healthy. Well, there's more I need to share with you that you should be informed about. So let's continue. So does it work as an anti-wrinkle, anti-aging treatment? Well, why don't we go to the FDA and check the studies? The results of 2 adequate and well-controlled trials of Renova containing tretinoin 0.05%, consisting of people under the age of 50, showed that 76% of patients saw minimal to no improvement in fine wrinkles. 62% saw minimal to no improvement of hyperpigmentation or mottled skin, and 84% showed minimal or no improvement at all in tactile skin roughness. Similar results were achieved for fine wrinkling in clinical trials with Renova 0.02%, but the 0.02% version failed to show improvement in hyperpigmentation and tactile skin roughness. Patients in the Renova 0.02 group were 45 to 71 years old. According to the package labeling, which is on the FDA's website, and in bold print, Renova does not eliminate wrinkles, repair sun-damaged skin, reverse photoaging, or restore more youthful or younger skin. And Renova did not demonstrate any mitigating effect on coarse or deep wrinkling, skin yellowing, age spots, dilated small blood vessels, sagging skin, atypical epidermal cells, atypical melanocytes or those pigment cells, or dermal elastosis, which is when the skin gets thick and appears yellow and bumpy because the elastin fibers accumulate and get hard. What I think you'll find interesting and helpful is that 40 to 50% of the patients that did not use the tretinoin cream and only used a comprehensive sun avoidance program and a regular cream experienced minimal to moderate improvement in fine wrinkles and mottled hyperpigmentation. The comprehensive sun avoidance program included wearing protective clothing, a hat, and sunscreen. In fact, it is suggested that tretinoin be used only after a comprehensive sun avoidance program has been adhered to and desired results were not achieved. The safety and effectiveness of Renova 0.05% has not been established in people over 50 years of age or in people with medium or dark skin color. And I was personally quite surprised by that because the over 50 age group is the one that is being told that tretinoin will help their skin. Now for Renova 0.02%, the safety and effectiveness has not been established in individuals older than 71 years of age. And they did do a study in people with medium to dark skin using the Renova tretinoin 0.02%, and it did not demonstrate a benefit over a sunlight avoidance program. And here's another thing that surprised me. Any improvement that was noticed in the first 24 weeks of using Retin-A, and after that there was no additional improvement noted, only maintaining what you had experienced for the first 24 weeks. So basically, any improvement you might see in your skin from using tretinoin, you'll see in the first 6 months. And after that, if you want to maintain that improvement, you'll have to continue using it. But is it safe to use for long term if you want to maintain whatever little improvement that you might have seen in those 24 weeks? Well, you should know that the safety and efficacy of using tretinoin on your skin for greater than 48 weeks is unknown. There have been no studies. And unfortunately, if you discontinue using tretinoin, any benefits you might have seen will be lost. Next, I'll discuss the side effects, because there are some things you should know. First of all, it's being used by women over 50 where there have been no studies performed. These are women who very often are menopausal. Their skin is now drier, and because Retin-A suppresses the oil production and sebaceous glands producing oil, this can lead to exacerbated dryness. So you've got aging skin, already a slower cell turnover, because as you age, your skin begins to turn over slower. You also, as you age, lose some of your fat layer under your skin. So this composition of a person's skin that's in their 50s is different than someone in their 20s who's suffering from acne, who has a lot of hormonal fluctuations, has a lot more estrogen, has thicker skin, and has a faster cell rate turnover. And this is why it can be very irritating. So some of the side effects that have been reported by people using Retin-A are redness, burning, itching, dryness, stinging, flaking, peeling, photosensitivity, being sensitive to the sun, and being sensitive to the cold, pain, and being sensitive to any touch. I read about one woman who couldn't put her face even on a pillow at night. It was so painful and inflamed. Swelling, increased wrinkling, enlarged pores, and a waxy, shiny complexion that does not seem to go away. Now, these don't sound too appetizing to me as far as a beauty treatment, and these symptoms can sometimes last for months. And what kind of a toll does this take on your body? Having to repair your skin constantly. That's work. Your body has to constantly do that. And as you get older, you heal slower. So it takes an even greater toll. Does that affect your immune system? You don't have to look too far on the internet to find people who have tried Retin-A and have been literally on fire with it and left with big problems. I was very distressed to read about people who have posted crying for help on community message boards because they used Retin-A as an anti-aging treatment for the skin. Some of them are in their 20s, in their 30s. They thought they were doing a good thing, and they are so unhappy because they have deep lines now around their eyes, in their folds, on their face, places that did not show signs of aging before. I personally saw a couple women that looked awful, and I would have never guessed that that's what it was, but we started chatting in the store. And she told me that she started using Retin-A. She looked like on fire. And actually, I thought, I don't know what she looked like before that, what type of aging she had, but she was in her late 30s. And her skin was as dry as paper and blotchy, blotchy red, real bad, and peeling everywhere around her mouth and her chin. And I just thought, wow, it's a tough thing to take, you know. It's a really hard thing for somebody to have to deal with on an ongoing basis. Again, we're talking about younger skin here, not older skin. And I think the older you are, the more, I think, sensitive your skin is, and the more careful you have to be. And how you metabolize things is all different with everyone. We're all individuals. Now, I know people are being told, well, push through it, use through it, but I think it's detrimental to think like that. I think your body is sending you a message. It's telling you, this is horrible, you're burning me, and, you know, please stop and let me renew myself and let me generate moisture. And moisture and hydration is aging's enemy. It is your best friend. Keeping your skin hydrated and plump and nourished is what is going to fight aging, not drying it out and having it peel off. That's actually quite detrimental for you and painful. And my heart went out to these people because they were so fearful that they would never get their old skin or the way they looked back again. They didn't like these large pores, but that has something to do with your skin having been burned. And now you're left with these enlarged pores. This is a common thing that happens with people who get a sunburn or too much sun. Initially, the skin will thicken after you get a sunburn or too much sun exposure, and then the skin begins to thin, and I believe that's what's happening here. And again, according to the package insert from Ortho Pharmaceutical Corporation, which states that tretinoin is a dermal irritant. The effects of using tretinoin on your skin continuously for greater than 48 weeks is unknown. And the results of continued irritation of the skin for greater than 48 weeks is unknown. And in some patients who used tretinoin for greater than 48 weeks, there is evidence of abnormal pigment cells, abnormal keratin cells, and dermal elastosis. I noted during my research that the treatment often prescribed for these severe irritations from Retin-A was steroid creams. Steroid creams will thin the skin and should be used with caution. Now, I told you that tretinoin affects the generation of the melanin in your skin. Well, it can lead to problems with that as well. That's another side effect that people have noticed. They've noticed that it can damage those cells and that you're left with white spots or brown spots that won't go away, or that have come up that you've never seen before, mottled areas that have appeared. Because what you're doing is you're affecting a process that's very delicate in your body, a process called differentiation, where cells are dividing, making new cells, coming to the surface, replenishing. This renewal is going on constantly. And your body wants you to be in a balanced state, in homeostasis, and it strives for that. So as soon as something is off, as soon as you start sloughing off that dead skin cell layer, your body goes into an alarm, and it says, oh my gosh, I've got to replenish that. I've got to fix that. So it gets busy, and it starts producing collagen, and the fibroblasts start making collagen, and they send more collagen to the surface to protect you. Why? Because the stratum corneum, that dead skin cell layer that I told you about, that people talk about like, you know, got to get rid of it, is actually living, and it is actually very beneficial. It is made of beneficial lipids and oils and cholesterol, and it has a function. The function is it holds water in the skin, it regulates hydration, it protects you from the environment, from mechanical things in the environment, from anything seeping into your skin, from bacteria, from organisms. It's there to help you. It balances your skin. It's like a little protective seal on your body. It's important, so you don't want to get rid of it. And your stratum corneum is your first line of defense against UV radiation from the sun. You should know that the inability to maintain the skin barrier function by disrupting the regulation of any of the epidermal components, such as the stratum corneum, can lead to skin disorders. So is there a benefit to exfoliation? Sure there is. It is beneficial when done gently and periodically and mechanically to help remove dead skin cells that may be accumulating in and around your pores. And you don't have to resort to harsh chemicals. You can do this gently by using gentle scrubs, or just simply using a wet washcloth to gently rub your skin. The process of exfoliating sends an instant message to your body, and it begins to produce collagen and rebuild and renew your skin. So, can you use Retin-A around your eyes for crow's feet or droopy eyelids? It is not recommended for use around the eyes or around the mouth, any type of mucous membrane, and it is not supposed to be traveling to your eyes. The skin around your eyes is incredibly delicate. One of the side effects that I read about was dry eye syndrome, and it is very hard to get rid of dryness in your eyes or on your eyelids, and something called blepharitis, which is a flaking and peeling and itching of the eyelids and around the eyes. And it is caused by a total imbalance of your skin's layer, and it's easy for bacterial growth to happen, problems to happen in that area of your face, and it is very difficult to treat. So you can read about this yourself. There are people saying that they got blepharitis and dry eye syndrome from the use of tretinoin, and I think you should be aware of that. I also want to mention that I did read about people experiencing eye problems that applied tretinoin to their face only, and they did not apply it around the eyes. More on that later when I discuss systemic risks. Remember, you are putting yourself through these awful side effects for minimal benefit at best, as we saw in the clinical trials. Not to mention that the benefit, however small, will be lost if you stop using the cream. Not a great risk-reward ratio if you ask me. And what about the risk to your body from absorbing tretinoin through your skin? Now we'll discuss the systemic risks. Now there's something else I also wanted to mention to you while we're talking about side effects, and that is the link between the usage of tretinoin and the development of Crohn's disease, ulcerative colitis, and irritable bowel syndrome. There are lawsuits pending where people have sued because they've developed Crohn's disease, irritable bowel syndrome, and they are suffering. They have extensive medical costs. There have been awards in this. The majority of these cases have been for Accutane, which was the oral version of tretinoin, also called isotretinoin. It was approved for use in the treatment of acne in 1982, and shortly after that, people began filing lawsuits claiming birth defects, depression, suicide, all kinds of awful side effects. And Hoffmann La Roche, the maker of Accutane, has paid out millions of dollars for pain and suffering and for doctor bills for people who suffered with it. Accutane was pulled from the market in 2009. However, there are generic versions of this acne drug called isotretinoin still available by prescription. There are people who claim that the topical form of tretinoin caused them to have ulcerative colitis, irritable bowel syndrome, and Crohn's disease. These are real people that are reaching out. These are not statistical tests that were done in a lab and extrapolated, to try to decide whether something is good or not. These are people who have used a medication and have found it to be detrimental to their health. And if you're someone that's using Retin-A right now or tretinoin right now, ask yourself how you're feeling. Is there anything about you, your whole body? Think about your state of health, not just your face and how the face is feeling and your skin is feeling, but is there anything about your health that's off, that's not the way it used to be, or you're not feeling well? Because perhaps you can connect the dots back to something that you're applying to your skin. Your skin absorbs. I'm going to talk about that in a second, but I also want to tell you something. I didn't make this link for myself personally until I started doing this research. And when I was about 20 years old, I used Retin-A. My dermatologist prescribed it for me because I had cystic acne. And he didn't prescribe it right away. He prescribed it after he tried several different things. And then when other things didn't work, we went to the Retin-A, which is how it should be normally done. And I remember I used it, and I think it was for about 3 months or so, and it was during the summer, so I remember, because I was bummed out that I couldn't be in the sun. And that's tough if you're in college, especially back then, because everybody wasn't as, sun conscious as we are today. But what I did notice during that time period is that I did develop an irritable bowel. I would never have made the connection in a million years then that my topical application of Retin-A could potentially have been causing that. Never. You think of other things. Your diet, your anxiety, whatever. I don't recall being anxious at all at that point, but I probably thought it was my diet or something that I was doing. Now looking back and thinking about how it came out of nowhere and then thankfully disappeared after I stopped using it, and it wasn't continuous, it would be bouts of it. I think it could have been my usage of Retin-A. That's my personal opinion. After reading about that and seeing other people saying that they used topical tretinoin and developed either IBS or Crohn's disease, I thought, you know what, that could very well be what I was suffering from. In order to better understand the risks of using a tretinoin, I think it's important to understand vitamin A. Now here's the thing about these products. They're derived from vitamin A. Vitamin A is such a crucial vitamin in our bodies. It is used in so many ways, and much of how it's used is not readily understood, but the body does not make its own. It stores it from your diet. It's the only way it can get it is from your diet. And there's two ways. It gets it from, animal products like liver and beef and eggs and things like that, and it gets it from vegetables with beta-carotene like carrots and spinach and kale. And with the beta-carotene, it has to convert it in the body to this form of retinoic acid or retinol and store it. And everything takes place in the intestines for that, and it's, the vitamin A is stored in the liver. So you've got the liver and the intestines that are affected by the Retin-A, but your body is so efficient with it that any little bit it will store. It's a fat-soluble vitamin. It gets stored by the body, and it does not get excreted if you have too much of it. So, if you're somebody that's using a topical retinoid, and you are also eating a lot of vitamin A foods, and you are taking a supplement, it is possible that you are going to get too much vitamin A. And with too much vitamin A, you're leaving yourself open for a lot of health issues. Problems such as drowsiness, abdominal pain, nausea, vomiting, increased pressure in the brain, vision changes or blurry vision, bone pain, sensitivity to sunlight, dry, rough skin, itchy or peeling skin, hair loss, respiratory infection, birth defects, liver damage, skin cracks at the corners of your mouth, osteoporosis, which is a condition causing bones to become brittle, weak, and prone to breaks. And this is something women need to be very sensitive to because as we age, we can lose bone density, so we don't want to increase the risk of that. And finally, coma or even death. So as you can see, too much vitamin A in your body can cause some serious side effects and problems. And recently, there have been an increase in complaints to the FDA from people using topical tretinoin, claiming that it is causing the side effects of hair loss, hair shedding, and bald spots. And as I just mentioned, these are side effects that can be caused by too much vitamin A. Anybody who's using tretinoin should not be supplementing with vitamin A because you don't want your body to get too much of it. You want to just get what's the normal beneficial amount. So I'm sure you realize, but I'll connect the dots for you, that the side effects of using tretinoin medication are similar to what happens to you when you have too much vitamin A in your body. Now there was a study done that I'd like to share with you that I found very interesting that I came across during my research. And it was printed in the Journal of Cutaneous and Aesthetic Surgery, and it was shared on the National Institutes of Health. And it was a study done with topical tretinoin to see whether it would prevent cancer. And it was done on veterans, and it was supposed to be a 6-year study. I think it had like 1,100 people in the study, and 566 of them were in the treatment group that were the ones using the tretinoin, and the other received like a placebo. Well, every day, twice a day, these veterans, they were 70 and older, I believe, applied this tretinoin cream, 0.1%, to their skin, to their face, including their ears. And they were evaluated. Well, they had to stop this experiment and they couldn't finish it because 135 people died. They considered that so statistically significant that they started diving in to see what was the cause of death, because they couldn't believe that it could be from tretinoin, a topical application of tretinoin. And what they found was that patients were found to have died from vascular disorders, lung cancer, and respiratory and cardiovascular diseases, with the possible cause of death being related to the use of tretinoin and/or retinoic acid syndrome. And they determined that more studies need to be done. But in my opinion, there must be some kind of a link between these older people and the use of this topical retinoid. And there's so much about the way the body uses vitamin A and its derivatives and how the body absorbs things. But things do get absorbed through your skin and into other areas of the body, especially if you use something long-term. And that's what we're talking about here. We're not talking about using it for acne for a few months or weeks. We're talking about using it as a beauty treatment every day for years. Again, just not a good risk-reward ratio, if you ask me. And you should know that the European Union has banned the use of any retinol products in their cosmetics, of all cosmetics, because of the risks of cancer. In a 91-week study, tretinoin was applied to the skin of mice and found to cause squamous cell cancer, papillomas, and liver cancer. And another study found that mice that were treated with tretinoin and exposed to synthetic UV sunlight developed a greater amount of tumors, and they appeared at a faster rate than the mice that were treated with the carrier cream, both with and without UV sunlight. Since it is not banned in the United States, you may want to check the labels of any products you purchase for your skin to make sure they do not contain any retinol, vitamin A, retinol acetate, retinol palmitate, all-trans retinoic acid, and tretinoin. So I'd like to pose some questions to you. We've established that the benefits of using tretinoin for aging of the skin are minimal in light Caucasian skin, and that there was no benefit demonstrated in medium to dark skin colors, and that the benefits are temporary unless you continue to use the cream for maintenance. But we've learned that they don't know the safety or even if it works long-term, and they don't know the effects of long-term chronic irritation of the skin. So why are women being told to use this to treat and prevent aging of the skin? Where does this narrative come from? And knowing all this and the reproductive risks, why are younger women being told to start treatment early in life to help prevent aging? Again, they don't know the long-term effects of using it for years. And how did it become referred to as the gold standard in anti-aging? Where did this narrative come from? So you might be wondering, as I was, what about people who put up videos on YouTube promoting the use of Retin-A or tretinoin and claiming that it has prevented their skin from aging, or it has removed wrinkles, or that it evened out their skin tone, or even that it has lifted their sagging skin or droopy eyelids, and that it's wonderful, and they show before and after pictures? Well, I think it's very hard to tell. First of all, it will not help sagging skin. It does not do that. And it will only help fine lines at best. And so I'll refer you back to the package insert for Renova, which is right on the FDA's website. You can check yourself, where it says, Renova does not eliminate wrinkles, repair sun-damaged skin, reverse photoaging, or restore more youthful or younger skin. And Renova did not demonstrate any mitigating effect on coarse or deep wrinkling, skin yellowing, age spots, dilated small blood vessels, sagging skin, atypical epidermal cells, atypical melanocytes or those pigment cells, or dermal elastosis. You have to make your own decision, and you have to weigh the benefits against the risks. Many of these women have used other things on their faces. They've used Botox and fillers. So there are a lot of other products in play here that are being used to structurally change people's faces. And, you know, maybe some of them are just not going to kiss and tell either. Some of them are very open about it, and they tell you that they're using these things, but maybe others, you know, don't want to say that. And they don't want someone they know watching the videos and learning about what they do. They're more private about it. And I've even seen videos where they're not even applying the tretinoin properly. They're applying it on top of oils or creams. So how can they even say whether it works or not if they're not even using it properly on their skin? And I'm not judging anyone who wants to use Retin-A for their skin. If you want to do that, you know, it's your body, and you can use whatever you want. I'm just presenting what's out there as far as the risks and side effects that you may be dealing with down the road. And, you know, some of these people developed, you know, ulcerative colitis and Crohn's disease, you know, several years after using these products. And I just think that when it comes to beauty, there's a lot you can do that's natural. You don't have to turn to pharmaceutical drugs, especially ones that have these kinds of side effects. And remember what I told you earlier, that nearly half of the people in the clinical trial who used only a regular moisturizer and avoided the sun had excellent improvement in their skin, with fine wrinkles and hyperpigmentation. But if you want your face to look smooth and you want those dark spots to really fade, wear sunscreen for a while. Put a hat on and avoid the sun, and you'll see how your skin will change. Take care of yourself. Women tend to take better care of themselves when they're on a prescription drug. That's why I did read something about it's hard to tell if, you know, if Tretinoin, the Renova, actually does work at all, or if it's the protocol that these women were following to stay out of the sun. Make the same effort for your skin that you would make if you were using a Tretinoin product on your skin, and do those things. You know, stay out of the sun, wear a hat, wear a sunscreen, and see what your skin looks like and how it feels. So let's do a quick recap of what we learned in this video, because I shared a lot of information with you. Well, what we learned about Tretinoin is that it's a Category C drug, so it's not recommended for anyone who wishes to become pregnant or is pregnant. And if you're breastfeeding, you should use with extreme caution because the effects are unknown. We learned that the oral version of Tretinoin is a Category X drug, as it has been shown to cause birth defects in humans. That there are minimal benefits for using it as an anti-aging beauty treatment, and that any improvement that you do notice in your skin is temporary, and that if you stop using Tretinoin, you will lose any improvements. Number 4, the safety of long-term or cumulative exposure is unknown. The side effects to the skin are numerous and very difficult. And we also learned about vitamin A and how important it is in the body, and that it is stored by the body, and that too much of it can be quite toxic. And that not only is there a risk to your skin and the differentiation process of your skin renewal, but there's also a systemic risk, possible Crohn's disease, irritable bowel syndrome, and other gastrointestinal problems that may develop. And we learned that it causes cancer in laboratory animals. And as a result of those studies, the European Union has banned retinoic acid and retinol palmitate in any cosmetics. And finally, we learned that a clinical trial of topical Tretinoin on humans had to be stopped because of a significant amount of patient deaths. And now I'll share my final thoughts with you. And I absolutely don't think it's for younger women. And I don't think it's for older women just because of the way your skin is aging and thinning, and you've got the reduction in oil glands. And so it's not for me. I'm not going to be using it. I have no interest in that. I'm trying to help you all to to do research into what you're using on your body, and think of your body as a whole. And if it doesn't agree with you, stop using it. Don't push through something that's giving you bad results. And remember to follow the money. Drug companies make a fortune when they can sell a drug as a beauty product, because now it takes on a whole nother life of its own and a whole nother market. So think about that if you've got questions in your mind that you can't seem to answer. And I'll leave you with one final thought. If the doctor who invented Tretinoin never used it himself as an anti-aging treatment, then why should we? Did Thomas Edison, who invented the light bulb, not use his invention? And I really hope you found this video helpful. Again, I'm not judging anyone that's using it, I'm just sharing information. I think we can all help each other. And I hope you'll share this video and spread it to your friends and your social media, because I think it's a real helpful message. And if you're new to my channel, I hope you'll subscribe, because I have a lot more to come. I have lots of interesting topics coming up this year, lots of helpful stuff. And please visit me at my blog spot where I do a lot of writing, and I'm also on Facebook and Twitter and Instagram, so we can stay connected there as well. Well, I appreciate your tuning in. Thank you for watching and staying with me through this entire video. Okay, bye-bye now.